Yeah, I think we're on.
Hello, good evening. Are we live, DocTutorials?
Yes, sir.
Wonderful. Hi, Dr. Kushal.
Hello, Dr. Adarsh. Good evening to all of you.
Good evening.
So we're just waiting for a minute for Dr. Gurava Reddy to come online. Meanwhile, we'll introduce ourselves. I'm Dr. Kushal. I'm a consultant orthopedic surgeon at Sunshine Hospitals, Hyderabad. I specialize in surgeries around the knee joint, that is arthroplasty and arthroscopy both. I've also done my specialization in robotic knee replacement surgery. And I've been working as a consultant at Sunshine for the last 5 years. Adarsh?
Yep. Yeah, thank you. Hi, everyone. I'm Dr. Adarsh AnnapaReddy. I'm an orthopedic surgeon as well. I'm also a joint replacement surgeon. I do knee replacements, including total and partial knee replacements, and I also do hip replacement surgeries. Apart from that, I also am a trained robotic surgeon, and I also train surgeons around India in robotics as well. So we are overall a joint replacement team, apart from being orthopedic surgeons. And we have the big man himself. He can introduce himself.
Hi, good evening, everyone. I'm Dr. Gurava Reddy, and I'm a consultant joint replacement surgeon in Sunshine Hospitals, Hyderabad. And I'm the chairman of Sunshine Bone and Joint Institute. And I'm the managing director of Sunshine Hospitals, Hyderabad. And the people who are on the screen, one is my son and one is my son-in-law. So you can imagine how good my life is going to be with these guys. Okay. So I've spent 10 years in England. Now it is my 23rd year in practice in India. So mainly joint replacements is my practice. I developed an institute with 24 consultants under one roof, so giving all the specialty practice. We do around 10,000 major orthopedic procedures per year, one of the largest of its number. We got a lot of research department, a lot of academics. We got 2 DNB seats sanctioned in our department. And we got 15 fellowships in orthoplasty and trauma, arthroscopy and all that. So it's a very vibrant department. And I welcome all the youngsters who want to be an orthopedic surgeons. And feel free to ask any question. We'll be happy to answer you. Yeah, so that is a format. So what do we do?
So what
we'll
do
format is like, yeah, sorry. You want to go ahead, Kushal?
We'll first start with your tidbits about orthopedic life in general and why you chose the same and what advice you would give the youngsters.
Yeah.
Me, for our generation, we will put in our thoughts.
So
right?
who is the organizer? DocTutorials, who is there?
So there's no moderator. We're going to do it ourselves.
No, but the man who is from DocTutorials, can I say hello to him?
Yeah, that's the IT guys.
Yes, sir. Good evening, sir. Myself, I'm Karthik, sir.
Karthik. So we are now live on YouTube or where?
YouTube, sir.
YouTube. So
Yes.
People are logged in. How many people are there?
Right now, around 20 plus, sir.
20 plus. So you want me to wait or shall we start? We got
Sir, people keep on coming, sir. We'll proceed, sir.
Okay, done. So right. So orthopedics is one of the fascinating branches at the moment. In fact, when I was doing my medical school, that is way back in 1977, orthopedics is still one of the poor cousins of general surgery. Very few people would go for orthopedics, and orthopedic ward is full of infections, trauma splints, and skin tractions. That's all. People used to be on the bed for months together for fractures to heal. Meanwhile, the bed sores will happen. All those things, the maggots, there will be infection. Some of the osteomyelitis limbs, there will be maggots and flies going around. So it was a horrible scene in orthopedic department. But with the last 20, 30 years, there is tremendous advance in orthopedics and a lot of advances. If you ask me, which is the branch which has got the highest advances in the last 20 or 30 years, orthopedics is number one. It has become so specialized. There are now almost 6 subspecialties there: spine, pediatric orthopedics, arthroscopy, sports medicine, trauma, Ilizaro reconstruction, arthroplasty, and spine surgery, like that. So again, the advent of joint replacement or arthroplasty has made a tremendous difference. So the people, it become a real glamorous branch of orthopedics. And because a lot of people suffer from arthritis in India, and knee replacement and hip replacement have become a standard treatment, and many crippled people will be walking within 24 hours by this excellent surgery. So the orthopedics is really from 1977. Let us say now how many years? So 23, and now another 23, almost 46 years since I joined medical college. So tremendous development happened, and I don't regret, and I'm really glad, and I'm fortunate, and I thank my stars for guiding me into orthopedics. And even now, when the youngsters come to me for guidance, career guidance, I tell them, take orthopedics without blinking an eyelid. The reason is orthopedics is a very straightforward branch to practice, especially with the advent of MR scan and CT scan, PET scan. So a lot of these diagnostic investigation modalities have come. Previously, we used to struggle to diagnose a hip problem or a spine problem. But now with MR scan, you know everything in the spine. So same thing with MR scan, you can know everything in the joints. So the diagnosis has become very easy. So then treatment also will become very standard. So whether you take a fracture care, whether you take a spine surgery, whether you take a orthoplasty, 90% of the controversies are settled. So in other words, practice guidelines or practice pathways are also very straightforward. If you got a conscious and if you are updated, you can practice orthopedics wherever you are. And the third point is enormous population, and all of them need orthopedics. All of them. If you go to 100 people conference, if you ask anyone to lift the hands who have not had a back pain or knee pain, or who got a back pain or knee pain, all of them will lift their hands up. In other words, the back pain and knee pain, 80 to 70% of people suffer. Not only that, road traffic accidents. The Indian roads, the Indian cars, one of the highest road traffic accidents in the world. So these people also need orthopedic surgeons. So arthritis and back pain and accidents, so all these put together, you have enough number of patients. That's why orthopedic surgery, wherever you practice in India, wherever, whether it is a village or district headquarters or tier 2 metro, it doesn't matter. You will have ample patients and very, very good practice within no time. In fact, I have never seen an orthopedic surgeon struggling for practice. It all depends on the place you select, however, but always there is a practice. And another thing is you don't need huge crores and crores of investment also for orthopedics. So you need a decent operating theater, and rest of the equipment people will, for example, joint replacement, you don't need to buy any instrument. They will give you all the instruments and they will take it back, the implant companies. So practice of orthoplasty is also very congenial to that. So, and another important point which I would feel, you make the people walk who are in wheelchairs. That gives enormous emotional satisfaction and psychological satisfaction. So all these 5 points put together make orthopedics is one of the most sought after branches in post-graduation. Financially also, it's very lucrative. As I said, I've never seen a poor orthopedic surgeon in my life. Wherever you practice, you will get minimum, once you establish, 5 lakhs a month, which is a very decent income. That's why it's very sought after in all over the world. In English-speaking countries, America, England, Australia, New Zealand, getting an orthopedic residency is next to impossible. Because there also, orthopedics is very, very valued and very much sought after. So with these reasons, orthopedics is #1 branch nowadays. And I have got my son and son-in-law also baptized into that. and I'm glad they are doing well in their fields. The only thing is orthopedics, when you do, you have to really get the principles right, and you have to see that their infections are very well controlled. So you have to spend a lot of money and effort to see that your theaters are completely aseptic. Just to drawing a gown on your dress and going into the theater and having a idli and sambar in the theater. And that's not the way you operate on the orthopedic patient.
It's
because you
not like Arjun Reddy.
Yeah, exactly. Absolutely. So what happens is if you don't take care of the infections will really spoil you. Because once the infection goes into the bone, it becomes osteomyelitis, as you all know, and it becomes very difficult to treat that one. So that's why my young friends, orthopedics is the best branch to get into, and it's a very decent branch to have a professional, intellectual, and financial satisfaction. So thank you so much, and I'm very open to take your questions also after these two youngsters talk.
Go ahead, Kushal.
Yeah.
Yes, sir.
Sure. Yeah, thanks, boss. So we call Dr. Gurava Reddy boss. You can't call him dad at work. And actually, I think at home also I call him boss because he's the boss. So, of course, the question is, do you want to be an orthopedic surgeon? I think you should. It's a wonderful, wonderful branch. First of all, it's an end subject. If you want to do any other surgery, you have to do general surgery. Then you have to study for some more years if you want to do CT surgery, whatever it is. So once you're done with your MBBS, you can directly join this branch. Another 3 years of studying, and you should be able to come to, you'll at least be an orthopedic surgeon. After that, of course, you can super specialize into arthroscopy or plasty, but at least you can start practicing immediately after that. So that's one major advantage of it. Secondly, I wouldn't say that it doesn't require a brain. Of course, there's a notion that all the dumb medicos go into orthopedics. I definitely hope that's not true, but because there is still a lot of stuff that we have to study, a lot of different diagnoses we need to make. But the thing is, it also depends a lot on surgical skill, which you can develop over time. So it's not like general medicine. You have to think of the whole gamut of things. You have your niche subject and you can excel in that. And now the specialization has also come for all the branches. Now even robotics has come as an upcoming sub branch as well. So there's so many different things that you can specialize in as well. Apart from that, if you see whether a lot of people are asking nowadays if it's a good branch for girls, definitely I think so. Before, as boss was saying, earlier days there was the pot-bellied, the old guys would go into ortho, but it's not the same anymore. You have a lot of girls coming in, and it's a very good branch for girls as well. I don't think that there's much that the girl cannot do in orthopedics right now. And if you really feel that the strain is too much in trauma cases and all that, there's always arthroscopy and arthroplasty also. We have Dr. Chiranjeevi with us, who is one of the, if I remember right, one of the only women arthroplasty surgeons, well-known arthroplasty surgeons in India. And she's doing very well. And I know a lot of arthroscopy surgeons as well who are girls. So it's a very good branch for girls as well to come into. And apart from that, for boys, of course, if you're in a medical college, orthopedic surgeons are studs right now. So in the olden days, I think it was different. But right now, I think the ortho guys have the upper hand. So that's from the attractive aspects of orthopedic surgery. Of course, as boss was saying, the beauty of this branch is they come in on a wheelchair and they go back walking. I mean, of course, if everything goes well, God willing. Probably a cardiac surgeon does something more important. He saves the life. But I mean, they don't really see much of a difference in terms of the life. Either if it doesn't go well, probably won't make it through this procedure. If it goes well, they still feel the same as before. But in orthopedics, we're changing the lifestyle completely. They come in a wheelchair and they go back walking. So we get more of the accolades. Okay, but of course it works the other way around too. They come walking, and sometimes if you have your complications, they may say that I came in walking, but you sent me back with the complication. So that is a very minor subset. I really feel that the joy of seeing somebody coming in on a stretcher or a wheelchair, walking out, is something unparalleled. And they become your friends for life, the patients. So it's a wonderful branch. Any points from your end, Kushal?
Yeah, so I'll try to talk about some points from the other spectrum that Dr. Gurava Reddy and Dr. Adarsh have discussed most of the advantages of this branch. I'll tell you some of the challenges. Number one, the competition is stiff. I mean, orthopedics is chosen as among the preferred options, right, from the toppers themselves. So if you really want to get into orthopedics, you have to score well on your entrance exams and get in, because a lower rank will not fetch ortho. So that's the first stark reality. The preparation has to be really good, and you have to really get into a good place. And that's then the second point. Although you have lots of DNB seats and you have more options today than you had, say, even 10 years ago, since it is a surgical branch, ensure that the place you go to, that place really has a good training, good PG program. Unless you do that little bit of research, you'll end up repenting. Why did I take this? Why should I not have done it in a different place? So one is scoring well. The other is choosing a good place for your orthopedics. Now, even after all this, since it's a surgical branch, the learning curve is slow. It's steep and it takes some time. So while you might see your physician friends quickly set up their clinical practice and start off, let's say after dermatology, they're already seeing lots of patients in their practice. For orthopedic surgeons, post PG, you end up spending lots of time in learning the surgical skills, because if you're in a city, then you have to do subspecialty practice. Subspecialty practice means you have to go and learn in depth about a particular subspecialization, whether it's arthroscopy or arthroplasty or hand, whatever it is. So that takes time. So while that is being built, you can't really focus on your outpatient practice. So the duration is stretched out. But the advantage, as Adarsh pointed out, is that it's an end branch. So you save those 3 years of super specialization that you would have otherwise had to do. Yeah, these are some challenges. And yeah, if you are into a subspecialty practice and in a city like Hyderabad, tier 1 city, then if you know the numbers, almost there are 1,000 orthopedic surgeons in Hyderabad itself. So you can imagine the amount of running around that orthopedic surgeons have to do. They can't just be stuck to a one hospital 9 to 5 and then done. They have to go around, because if you're subspecialized, then you have to get patients. To get patients, can't sit at one place. So you have to keep moving around 3-4 hospitals every day. You have to keep traveling. Weekends, you have to go out. All these things have to be done. So this is also part of the challenge. So it's enjoyable, but at the same time, you should know that this is what it is. And of course, the referral based, networking that you have to do with other doctors, because if you're a subspecialist, then you have to get patients from other doctors, other orthopedic surgeons, other physicians. So that amount of running around. So while these are some of the challenges, I would still say the advantages outweigh these challenges. So definitely all three of us agree that it's a very good branch to pick up. And if you have the chance, the opportunity to train in a good place, definitely go for it. But the final decision, also one point that I'd like to make is, look at your seniors, look at people who are good practitioners, see what's your life like after 5 years, 10 years, 20 years down the line. Do you want to live that kind of life? Then also choose. Don't just choose based on the interest for the subject. See what you'll be doing at the end of 10 years, 20 years, and then pick it up, because it's a slow process.
Yeah, as Kushal was mentioning, you will have to, if you really want to, make a name for yourself. There's a lot of competition nowadays. If you remember 15 years ago, boss, you were almost traveling every single weekend to different parts of the state. Am I right? Can you just tell us how your journey was in the beginning?
Yeah. So of course, Rome is not built in a day. I always say that whoever comes into whatever branch, and there will be competition, but competition, without competition, there is no life. Then while being born also, there is a competition. One ovum, that million sperms. That itself, the competition starts from there. So no problem. You should relish and enjoy that competition.
Yeah.
Only thing is you have to be truthful.
Share with these guys how your beginning was.
Yeah. In my initial 5 years, I spent more nights with a train ticket collector than with my wife. I used to go to 12 places: Guntur, Kakinada, Vizag, Vijayawada, Poddutur, Nellore, Calcutta, Bhubaneswar, Siliguri. So many places I used to visit. Every weekend I used to be on the road, on the train. So that sort of thing. Otherwise, you will not get that critical mass. So of course, times are changing. With the technology, you don't need to travel that much now. But at the same time, but you have to keep running to stay where you are in the private practice. But we are not going to dissuade from that. Hard work, commitment, and dedication are part of anybody's successful life. Otherwise, nothing will come free on a platter. But which branch you select, I would think orthopedics is definitely one of the top, I would say 3 branches at the moment.
Another point I want to just elaborate on what Kushal was saying. He was saying that make sure you choose a good institute, which is true to an extent, but I would also say that you have a lot of scope to develop your skill even after you pass out. Of course, we both studied in different places. I did my orthopedics in Pune in Sancheti Hospital. He did it from Nagpur, and that is Sushruth Hospital. But I feel that 3 years that you're there, try to make sure that you grasp a lot of theory as much as you can. Even boss also keeps on reiterating this. Don't worry and don't cry about the cutting is what we usually think about when we're talking about surgeons, right? We think about how much cutting we're going to get, how much surgical exposure. I feel the 3 years that you're doing your PG, try to grasp as much theory as you can. Try to grasp the principles. What is an offset on the hip? What is the correct angle of the cuts? How do you put the plates properly and all these things? And then when you pass out, you will always be able to catch that up. I feel boss says you can even learn surgeries on YouTube, which is, partially true. So if you get your principles right, you can always implement them better. I have seen surgeons who have been exposed to a lot of cutting during the training days, but really they don't have very good outcomes because they're just putting the plates in any direction that they want without any principles. So of course you have to choose the right place to learn and to train. But I feel that it can be made up later as well in terms of surgical skill. Any comments?
Yeah, very good point. In fact, I would advise all the youngsters, DNB or MS Ortho, the 3 years is not for cutting. It is for learning principles. In fact, if you got too much cutting in the 3 years, that means you're not trained right. In fact, the 3 years after that, what you call post-MS or senior residency, that sort of thing. So after MS, the first 3 years, whether you spend in private practice or associate to senior surgeon or continue in the same institute as a senior resident, that 3 years will make you as a surgeon. The first 3 years of post-graduation will make you as a complete doctor. So unless you're a doctor, you will never become a surgeon. Very important point. As Adarsh rightly said, if you get too much cutting in MS, you will get confident, arrogance, and you will do the same mistake again and again. You will put the plate wrong way after 1,000 plates also. So that's not right. So don't clamor for cutting.
You don't know it is wrong.
See, but if you see, like the Sunshine is one of the premier institutes whereby we have all the facilities and we give a lot of hands-on practice to the trainees. But it should be backed up by good theoretical and good modules of the teaching also. So just going and doing a DHS, putting a nail, no doubt it is it feels good as a surgeon. But you have to know how to treat the patient, how to treat the complications, how the boss is talking to the relative, how the boss is explaining the preoperative things to the patient, how is the boss explaining the postoperative complication. All these things you will learn. No textbook will give it to you. That is where you should learn. Okay, and how to deal with empathy with the patients and all that stuff. Surgical cutting will come, no doubt about it. Don't worry about that.
Yeah, absolutely. And one more thing is this bias between MS and DNB. Don't get caught into that trap where the old mentality will be, if not MS, don't go for it. No, that's not the right way to do it. DNB is on paper equal. There is no difference, although it is a newer degree. It's just that certain institutions are not yet doing a good job in their PG training curriculum. But even if you get a DNB seat, don't just dismiss it because it is inferior to MS.
Absolutely.
I'm not MS.
Yeah.
Kushal is not MS. Both of us are DNBs. So DNB is as good as MS.
I would say they're trained even harder because their exams are tougher to pass.
Exactly. So DNB is as good or even better than MS. It's not better or good. It is how you get trained and how you pick up the 3 years of training. Even in the worst institutes also, you can train yourself. And with all these DocTutorials and YouTube and all this postgraduate Telegram programs, you can pick up the teaching material wherever you want. So that is the beauty of you being. You are at the right spot, the sweetest spot to learn in the world now, thanks to the internet and thanks to the flick of iPad. So don't worry about that. As Kushal rightly said, if you get DNB, take DNB. Don't waste years of time to get into MS, and don't waste loads of money to pay donations or capitations for the MS. You don't need to do that. Okay.
Questions in the chat, Adu?
So shall I start reading out the questions?
Yeah, sure.
Right. So I'm logged into the YouTube channel, so I'm just going to read out the questions. So there are a few people first who want to say hi to boss. Saikiran says, great to see you, sir. And Dr. Mitinachi, a good friend. Good afternoon to my teacher and guru par excellence, Dr. Gurava Reddy Sir. Okay. So I'll start off with the questions. Mr. Cruz says, sir, in comparison to other branches, is it difficult to get SR-ship in ortho in private as well as government hospitals?
In India?
In India, yes.
Not at all. Not at all.
Not at all.
There are many orthopedic surgeons in India, including us, who are very, very happy and invite the people with open arms to come and train whatever the time you got. If you got only 1 month, you can come as an observer. If you got 1 year, you can come as a fellow. So simple. If Sunshine is open to all the people, we say that for learning, we are always open.
Yeah.
So like that, there are so many institutes in India.
Yeah.
So no problem at all.
Wonderful. Okay. And a question from Tanya Zarar. I think I already answered this. Sir, how is ortho as a branch for girls? I'd ask boss to answer this.
Yeah, the Tanya, the orthopedics is a decent branch now, even for girls. Not even for girls, girls also. Because in the olden days, it should be a lot of traction, pulling and pushing, close reduction. Now, seldom you do close reduction for a fracture femur or a fracture tibia. If it is displaced, you will go and nail it, as simple as that. So it is as good or as dexterous as anybody. So you don't need to be masculine to do orthopedics. And there is a arthroscopy is there. Of course, orthopedics only the trauma, it consumes your night time. So you got to raise children, you got to be a mother. So you can just choose yourself elective orthopedics like a joint replacement or arthroscopies or hand surgeries or pediatric orthopedics. So there's no problem. Or you can ask a husband who is an orthopedic surgeon, both orthopedic husband and wife also very good combination, because both of you can learn from each other and help each other. In the theater, always two orthopedic surgeons are more beneficial than single orthopedic surgeon.
Only problem is
no other brand, two surgeons make a difference. The orthopedics.
The only problem with that is you can't escape from each other at work also. So
yeah, I don't have a comment. My wife is a gynecologist.
Right. So and also I think there is now a quota for girls also in orthopedic seats.
I think
every year you have to take 2 girls. I mean, there is a quota for girls, if I remember right.
Yeah.
Any idea on that, Kushal? Not sure.
I don't remember, but I think so.
So okay, let's go on to the next question over here from MVN Nitish. What about the expenses? Can most Indian people afford it? So I think we'll ask boss only to take this question. Till then, let's go a question to Kushal from Bharat Simha Reddy. What is the scope of research in orthopedics? Kushal?
Yeah, tremendous. Just like any other branch. On that front, I don't think it differs from any other branch. The thing with research is your institute should have that aptitude for research. Correct. If it doesn't have, then you'll end up not doing any research. But if you're in an institute like Sunshine, where we focus a lot on research, or even if you're in some medical college where their focus is primarily that, and that depends on how your HOD has molded that department. So if that aptitude for research is there amongst your seniors, you can definitely do good amount of research. Yeah, that's the thing.
I agree with you. Yeah. So yeah, it's all about how you put your mind to it. And we are, as you said, we have really developed a good research department in the last few years. But you need that impetus. I guess it's the same for any branch. Can I get a question to Dr. Gurava Reddy? Okay. Okay, next. Okay, we'll go to the next question till then. The question I'll again ask to Kushal. So will you please elaborate more on the subspecialties? So you can talk about the different subspecialties that we see.
Yeah, subspecialties, basically there are 6. Number 1 is arthroplasty. That means joint replacement surgery. Number 2 is a spine surgery. Number 2 is arthroscopic surgery. That means keyhole surgery. Number 4 is a trauma. That means accident and fracture care. Number 5 is a pediatric orthopedics. That means cerebral palsy, clubfoot, and all the children's orthopedics. And number 6 is limb reconstruction or ilijaro. That means all deformed limbs, you try to make them straight. And number 7 is a hand surgery.
Tumors?
Onco.
Next is orthopedic oncology. Yeah, that means bone tumors or cancer. So total 8 subspecialties are there.
Yep.
You don't need to practice only one specialty. You can practice 2 subspecialties also. It's better, in fact, if you pick up 2 out of these 8 and do good about it. Nowadays, people are coming with anatomical specialties. That means geographical, upper limb surgeon or shoulder surgeon, knee surgeon, hip
Like
surgeon. Like that. Yeah. Now, Kushal is a comprehensive knee surgeon. He can do everything about the knee, arthroscopy, arthroplasty, everything. Whereas I can't do arthroscopy. I don't do arthroscopy. So that's what it is. So there are 8 subspecialties. Okay.
Another question to boss from MVN Nitish. What about the expenses? Can most of Indian people afford it? I think they mean to pursue orthopedics as a branch.
0. If you are good, you will get DNB seat wherever you are in India. And thanks to, as I said, when we were doing, hardly any PG seats are there. And there are so many regional barriers are there. Now you can get NEET seat anywhere. That's why you are doing the DocTutorials now. Yep. Anywhere in India. And MS and DNB are same. Don't worry about that. Just pick up a good institute and go for that. You don't need any money at all. In fact, in DNB, we pay you the money. We pay you the stipend. Yeah. You don't need any penny.
Another question. Again, financial viability. So I'm going to ask boss about this. Anisha Memdani asks, MS surgery versus MS ortho in terms of financial viability.
After the MS, probably.
I mean after going into the branch.
After finishing MS orthopedics will earn 10 times more than MS general surgery in the first 5 years. No problem at all. Because MS general surgery has become very broad umbrella. All the specialties have taken. Gastroenterology people have taken gastroenterology. Neurosurgery have gone that side. And cardiothoracic surgery has gone. Pediatric surgery has gone. So what the general surgeons are left with are hydrocele and hernia. Even the hernias are taken by laparoscopic gastroenterology surgeons. So MS general surgery itself is very difficult to survive unless you go for a super specialty for another 3 years doing another MCH.
Yeah.
So orthopedics doesn't need a super specialty. MS orthopedics straight away you can go into practice. The financial viability is 10 times more than general surgery.
Yeah. Okay, so I have a question, 2 questions from Reshma Rayala. I'm going to ask both of these, one to Kushal and one to boss. First question to Kushal. How much is the scope in academics, which you partially answered previously? And what do you suggest? Clinical practice or academics or both? That's to Kushal. And to boss, which is best to improve surgical skills? Will you get more exposure in government or private? So let's ask Kushal first. Academics versus clinical or both?
I mean, that depends on the person. So the interest level that the person has towards academics or clinical. I don't think I've seen any orthopedic surgeon doing only academic work. Most of them will begin with clinical, maybe towards the later phases of their life. They prefer to move more towards academics. But as to start with, no, I mean, clinical has to be part of it. And the second one, I think financial, is that what was the question?
Next question is more exposure to variety of cases, government or private?
No, in that within academics.
The question is, no, they just said what is scope for academics? Will you suggest clinical practice or academics?
Yeah, that's the one thing. And the second thing is in terms of the pay, clinical work will fetch you much more because as you have a patient base of your own and you operate on that patient base, the financial rewards are better. The recognition is more. So academics is is a separate kind of a interest. If you have that kida, then definitely go for it. But it has its
limits. Will give you more standing in your own fraternity, but not in the population, like in the society. Clinical will definitely give you more crowd in the society.
Yeah.
So, boss question is
coming to the exposure. Both government hospitals and private hospitals are almost equal now. But of course, government hospitals will have more variety of cases because some of the cases don't come to the private hospitals, like polios, cerebral palsies, osteomyelitis, those sort of things. And they come from low socioeconomic and they can't afford the corporate setups, and so they go to government hospitals. And government hospitals, definitely the case mix and the case quantum is more. And the teaching methodology is also, no doubt, government hospitals have got a much higher and deeper methods. But now with the private institutes are also catching up, there is a good case mix is coming. But nowadays, slowly, polio, cerebral palsy, osteomyelitis cases are going off. Tuberculosis, those are all now disappearing from the scene. So if you are open, if you are in the city, any city in a metro, let us say if you are in any, for example, DNB or MS, you will be doing anyway tier 1, tier 2 metro. If you are open, you can go to other institutes also to learn or to see the cases. Many people will be open and they will be doing that. And in fact, we are doing a curriculum with the DocTutorials. The whole MS Ortho curriculum we are developing, Sunshine Hospitals. Shortly, we will be launching that. That will give you 3 years complete synopsis of the teaching, the long cases, the short cases, everything. If you see that curriculum done by us, you will just don't need to see any cases. We get all the cases incorporated with the videos, how to examine them, what are the questions people ask, and how to answer them like that. So a lot of things are there for you to now get the learning. If you don't learn now, it is your mistake.
Yeah. Okay. The next question is for all three of us. Let's have our opinions on this. What is the best sub-branch in ortho to focus on for your future? So let's go one by one. I'll go first, alphabetical order. I am an arthroplasty surgeon. I do joint replacements. So I definitely feel arthroplasty is one of the best branches. It has, I would say it's more lucrative. You have much less amount of emergencies per se. You don't have to like really burn the midnight oil usually. And if, of course, there is a lot of competition, but I feel that it gives the most satisfaction in terms of the patient outcomes. So I would say arthroplasty, and in that again, robotics is an upcoming field. So I don't know if the other two also have the same answer or not.
Kushal.
Yeah. So when you say best, I mean, if you're purely talking about financial model, then yes, because of the incidence of arthritis among the population, then you'll end up getting more patient base, and it's a quick, you can build up the practice quickly. That way it is, yes, it is the best. There are many pros and cons, but I would also agree with others saying that is, if broadly, if anyone asks what is best, then that is what it is. I would say
there is no second thought about it. Arthroplasty is the Amitabh Bachchan of orthopedics.
Okay, so it's a unanimous vote for arthroplasty, guys.
That's it.
Okay, but then it's too much competition for us, so let's give some other answer then. Just kidding. Okay, so another question from Mr. Ravi. Again, I will ask boss to answer this with his experience. I got MS Orthopedics in an average college this year. Can I join?
Yes, you should. As I said, you pick up as much knowledge as possible from the theory, from the YouTubes, or you can visit places like us and get the MS degree into the hands. And then go and join in a good institute for senior residency for 1 to 2 years. And then you can go to practice. Yes. Even in average college, your MS Ortho is for degree. You will get a degree. So I don't have any problem with that. Yeah. But that 3 years you can use it because you have so much opportunities to learn. As I said, just now I told you, in the 3 years, if it is average college, there is no teaching, just pick up a DocTutorials module and then go through that. They will teach you like a spoon feeding. So that's what all these platform virtual platform tutorials are there. You are so lucky. In our days, if I wanted to put my hands on one journal of 2 years old, I have to midnight sneak into the library. But for you, finger snap, you will get a thing. So go and join. Don't waste time.
One more thing to keep in mind is while doing all these 3 years, also have at the back of your mind that there is a resume you want to build, because we forget in the day-to-day churn in the heavy duty of your institute that at the end of 3 years on paper also it should look good. So wherever you get a chance to present papers in conferences, whenever you get a chance to publish research, do that and proactively build your resume.
Correct.
Yeah, because after 3 years, when you want to apply for an institute like Sunshine, if you have got a couple of papers published, then you will have a good chance of getting a fellowship here. So like that. Yeah. So build yourself. So nobody can prevent you from building your personal dossier or personal career ground. Yeah.
Great. Okay. So we have a good question from Naren. Sir, can we do MRCS after DNB Ortho? That's a question.
Why not? Why not? You can do it. MRCS is a good degree from England. You don't need to go to England at all. And it will give you good basics. It will add to your profile. No problem.
I don't know if he's asking about eligibility. I don't think so.
No, you can do eligible.
You're eligible to do either.
You're eligible. You're eligible and you can do it. No issues.
Yeah. There's a message from Varun Chowdhury, Mullapudi. Yes, Sunshine is an open institute. I feel Gurava Sir is my guru. Okay, I got a student observership in my 3rd MBBS at Sunshine. Thanks, sir, and hoping to join as a DNB. If you do well, you can join. We can't push you through.
So one more point there, since looks like you're an aspirant, so Sunshine DNB program has produced a gold medal. So Dr. Asha is from Sunshine who got a gold
medal.
India
gold medal. All India gold medal.
We have a gold medal and we have some of them. What's his name? He has so many publications after he passed out.
That guy is gone to England. Yeah.
Matthews.
Yeah, Matthews. Yeah. So we have very good students. We have a good training program. So definitely you can consider. Right. Again from Naren. MS Ortho from a peripheral college or DNB from Ganga College? Wow, which is better? This is
a question again.
MS Ortho from a peripheral college or DNB from Ganga College? I would say DNB from Ganga.
Without blinking an eyelid, Ganga.
Yes. If you are...
prepare for 3 years of loss of sleep.
Yes. Definitely, I would feel that too. Kushal, I think you would agree?
Yeah, no doubt.
The reason again is DNB is equal to MS. So don't think that MS in a lesser college is going to be equal to DNB at a good college.
Even now for government jobs, everything also DNB is recognized now.
Absolutely.
Even to go for England, FRCS, MRCS, it is recognized. So enormous opportunities.
Yeah. Again, another question from Naren. This will go directly to Kushal because he's a sports guy here. How is the scope of sports medicine after MS Ortho?
Yeah, it's great. There's no doubt about it. See, the only thing is competition. Everywhere there is competition, all branches, all subspecialties. So competition is something that is common to all our entire field is kind of it's exposed to this thing called competition. So you have to work your way around that. And if that happens, then it's a very good branch. Number one, this demon of infection, which is there in arthroplasty, that's not there. I mean, it is there, but to a much lesser extent in arthroscopy because it's keyhole surgeries and you're not invading much of soft tissue. So that way it's good. And results are extremely good. There is no, if you do a good job in your surgery, the average patient or even the sports person, the athlete is very happy with the outcome. So on both these fronts, it is extremely good. So if you're interested, nothing like it.
Definitely. In fact, I would say now with a lot of the IT crowd and a lot of knowledge about this subject in the public as well, they're coming forwards to get these procedures done. And so if you do arthroscopies, it's definitely a good branch. You will have good work.
Arthroscopy has got the second largest practice of arthroplasty.
Yeah. Okay. Sir, what is the most difficult orthopedic surgery? I would say a revision case. Any patient who has gotten infections, then taking out all that debriding all that necrotic tissue and putting in a revision joint, I feel is very complex. Because acetabular surgery in trauma is also very difficult. From your experience, boss? Most difficult orthopedic surgery.
Most difficult orthopedic surgery. There are so many surgeries other than arthroplasty, because arthroplasty is one of the easiest branches, surgical technique wise. If you ask for general orthopedics, total orthopedics, there is the polio corrections. And so those are very, very
I think they're obsolete now.
Corrective osteotomies, pediatric orthopedics, those are all very, very difficult.
Yes, of course. Scoliosis, Kushal mentioned.
Scoliosis.
Yeah.
Arthroplasty is a very, very easy surgery, technically. In arthroplasty, revision hip surgery is the most complex.
Okay. Atindra Bagh says, good evening. I am an MS orthopedic. On what basis should I choose my subspecialty? On what basis? I think you can talk about financial basis, and you can talk about like whether you want to do emergencies or not. You can talk about what is the most amount of patients coming to you for, if you have a lot of spine patients in your area or something, and probably more of what your boss has taught you. Usually it comes down to that. Wherever you have practiced or wherever you have studied, if you observe your boss, you usually get inspired by them. So I think these are the different criteria on which you can decide. You want to chip in, Kushal?
Yeah, so the first thing you want to do is understand what you want from life and where you're going to settle. Are you going to be in a tier 1 city, or are you going to be in a tier 2 city, more district practice? Each of these factors will then determine what specialty is best for you, whether you need to subspecialize or not. Because if you're in a smaller town, then trauma will be your base, and then you can add on 1 or 2 subspecialties. But if you're going to be in a city, then you have to narrow down, as boss said, to just 1 or maybe 2 subspecialties. So really ask yourself, what do I want in terms of the finances? Do I want quick money over 5 years? Am I okay with that? My passion is so much for something else, which even if I have less money, I'm okay to stretch it out over a period of 15 years, something like pediatric orthopedics. It's going to get fewer patients, but over a period of time, you'll get the name. So a lot of variables to answer that question. Ask yourself what you want, and then pick the subspecialty based on your needs from your profession.
Yeah, it's a very difficult question to ask, but I would say that at least pick up 2 subspecialties if you are in tier 1 city. Tier 2 or even tier 3 cities, you got to stick to basic trauma and general orthopedics. But if you are a good orthopedic surgeon, you should have knowledge in all the subspecialties. Because nowadays, again, you are very lucky. Within 100 kilometers, you will have a specialist. So let us say you are practicing in a tier 2 town or tier 2 city. You can practice general orthopedics with your friends in 100 kilometers giving you specialty cover. But you don't screw up the chair, because you can't be doing everything right. So, but you should know which one needs what. That itself gives you enormous leverage. And then you can call your friend to come and operate. You can tell the patient, I'm calling my friend, or you can no need to tell also. You can simply tell that we can do that. And as far as you deliver a good outcomes, and as far as you do right surgery to the patient, either you or your friend, doesn't matter. So now be beautiful. Again, as I said, you're all in a wonderful time. Within 100 kilometers, within 1 hour, wherever you practice, there will be a specialist, either in a joint replacement or in a spine surgery or in arthroscopic surgery. So take use of that. So that's what it is. So pick up 2 specialties if you want to tier 1. And again, as Kushal said, some people are very fascinated by Ilijaro. It is very complex surgery, because for me, I can't be in the operating theater more than 1 hour at a stretch, because I'm like that. I'm a very fast guy. Ilijaro takes 6 hours, 5 hours, but some people just keep on doing that year after year, rest of their life, because they are fascinated by that corrections, by that calculation, because they are mathematically oriented. Some people really love to do polio surgery. So some people like to do scoliosis surgery. They're all, again, the passion. So if you don't have any passion, and if you are just looking for a practical, practice-wise answers, then again, it depends on the surroundings. Suppose if you are in a Bombay, if you want to do arthroplasty, it's a dog-eats-dog competition. So many hundreds of number 1 orthopedic surgeons are there, who are there for years. So if you move 150, 200 kilometers away from Bombay, and then again, you will have a good practice. So you do that, always like that. So start with general orthopedics, but do good outcomes for every patient. That's a very important point.
Yep. boss, question for you again. What is the best college in Andhra Pradesh for orthopedics? Maybe you can answer for Andhra Pradesh and Telangana.
I don't know, to be frank. Andhra Pradesh and Telangana. For MS, you mean to say, isn't it? Telangana, I think Osmania, Gandhi, and Nizams, all three are good. As far as I can see that. And Andhra Pradesh, my birth college, my birthplace, Guntur and Vizag are good. But I don't know the latest faculty, latest developments in those colleges. So it will be very wrong. I may be wrong also. But in those days, Guntur is number one and Vizag is number two for post-graduations. Things might have changed. But you will know that, because again, it's not rocket science. You ask for a previous batch guys and 2 phone calls will be enough to do that.
Yeah. What he said is absolutely bang on. Don't go by a traditional concept that, Osmania NIMS Gandhi, Osmania NIMS Gandhi. There is nothing like that. Just go and find out from your immediate seniors how their experience was. Do a little bit of research about the current trends in those colleges, because that's very important. Things keep changing as the HODs change, as time goes by, the culture changes. So it's very important to be abreast of the updated standards of all these places.
Yep. Okay. So this is a question from TLSPS Moon Age Daydream. Very interesting name. Right. Thank you, sir. What are the challenges for the student after choosing ortho for PG? And will you please give a few advice on how to face them? Example, for those who want to start an independent practice. Oh.
After PG, you can start independent practice, no problem, but don't go all out. Don't spend lakhs and crores of your father or father-in-law's money. Start with a simple thing or attach to a hospital and pick up the nuances, because you will learn from the practice. And then slowly you can build up. Don't build a 100-bed hospital on the day one with just a MS Ortho. No, you need to practice at least 2 years after MS Ortho. Then only you can go for a bigger hospital, even if you are loaded with money.
Yep. Okay, I think we have time for just another few questions. We have another 5 minutes to go. A question from AB. After pursuing MS Ortho, if given a chance, where do you think we have to settle? In a district headquarter or in a metro city? As there are a lot of ortho surgeons in all the metro cities.
I would say district headquarters without hesitation.
Yeah.
Because the competition is less and you can make your mark very fast and you can just travel 1 hour and go to metro. As simple as that. Even in the districts now, there are good schools for your schools, education to the children. Because education to the children is the most important point when you select a place. So that's no problem at all. I would go for a district headquarters because the metros are saturated like anything.
Right. Sai Prashant asks, hello, sir. Is it tough to clear MRCS after MS Ortho? Because majority of the portion is general surgery.
Not at all. MRCS is not at all tough to pass. There are very beautiful books are there. Yeah. Beautiful online guidelines are there. That's easy to pass. I don't say very difficult. It's a good, easy to pass.
Yeah. Yeah. So, 2 questions from Gaurav Singh. Sir, is ortho saturated too much? Which is a good question. And again, is work-life balance good in ortho? So I'll ask boss to answer the first and I will answer the second.
Orthopedics is never going to be saturated as far as the roads and cars of India are there. With this population, 1.3 billion population, it will keep on increasing. So there is no dearth of patients for orthopedics. How you pick up the place, that is important. And number 2, what is the number 2?
Work-life balance.
Work-life balance, again, it depends on you. However busy and however big practice you are. I'm now going in another half an hour to a movie. Okay. Gangubai of what is that?
Gangubai.
Yeah. Gangubai. So in another half an hour, I'm going to the movie with 50 people. 50 of my family, friends, and my fellows. So it's a work-life balance. It all depends on how you juggle the balls. And it just comes from experience and some wisdom. Don't put all the hours into the work. And family is also very, very important.
Which is the same for any branch, not just
any branch.
I mean, sometimes I guess like things like cardiology, you have an ER, maybe in emergency medicine, you have to be there like for night duties and things, and you have emergencies and stuff.
But there are other times when they are off also. That time you should not sleep. You should take your wife out.
Yeah, I guess so. Okay. Again, Naren's question, which we've already answered before. One doubt is, how about cutting chances in DNB? How many are saying we don't get in corporates? Don't bother about cutting so much.
Yeah, don't bother about cutting, but you will get cutting provided you show your sincerity and your application in the first 2 years. Yeah. By the time you come to third year, you will get a trauma cases, plenty. Correct. No problem at all.
Okay, we'll take the last 3 questions from Bronco Ironheart. Sir, ortho with fellowship versus general surgery with MCH in terms of earning? I think we already answered this. Ortho with a fellowship will definitely give us more in terms of earning.
More. Yeah.
Shali's Corner asked, I want to become an orthopedics, but what is your opinion, women becoming orthopedics? We already answered this.
Definitely. Yes, go for it.
We need more women in orthopedics. No doubt about it. And Shiva Kumar, how to deal with a patient in infected TCAR? That's a bit of a very narrowed down question.
That's a scientific question. You can email to us and or come to Sunshine, we'll show you.
Correct. Okay, so last question. Sneh Shah, good evening, sir. How can I prepare for fellowship at Sunshine Hospital? So you need to read up a bit on your basic ortho. You don't need to know too much about arthroplasty.
Exactly.
You need to have some kind of inclination towards research and then get in touch with us.
That's right. Yeah. Okay.
Wonderful. Okay. So I think we are coming to the end of the session. Thank you for having us, DocTutorials. Thank you, Dr. Gurava Reddy and Dr. Kushal.
Thank you so much. How many people are logged in?
I think he mentioned that we had 305 views on YouTube and 70 people live.
Okay, good.
Sorry?
402 till now, sir. 402.
Wonderful. Okay.
Good. Thank you so much, all the youngsters, for patiently listening. Listen. The career is important and you are in a great times. Learn, do well. End of the day, you should save so many lives. And if you've got any problems or any questions unanswered, come to us. We're always there to help you at Sunshine. Thank you.
Thank you so much.
Thank you for raising the event with your presence, sir. Honored, sir. Thank you so much.